Okay, so let's do day 14, government schemes and social sector. Why this day is high ROI? Government schemes appear in phase 1 MCQs, direct factual questions, and phase 2 essays, real world examples. Interview. What scheme do you know for farmers, women, or poor? One day of focus study marks across all three stages. Let's see. Organizing schemes by themes. Too many schemes equals confusion, so we organize by who they help. Theme 1 is farmer schemes. Let's see. So we have these schemes for farmers. PM Kisan. It does direct cash to farmers and key numbers. Okay, so 6,000 per year in 3 installments, मतलब 2,000 2,000 2,000 in every 4 months. PM Kisan Yojana, direct cash to farmers. PM FBY बीमा योजना थी, crop insurance. Farmers pays 2% premium only. Nice. KCC is cheap farm credit. क्रेडिट लोन होता है नहीं ना, चीप फार्म क्रेडिट 4% इंटरेस्ट रेट, हाँ लोन होता है 4% इंटरेस्ट रेट पर KCCs. ओके, ई नाम ऑनलाइन मार्केट फॉर क्रॉप्स एलिमिनेट्स मिडलमैन. PM कृषि सिंचाई इरिगेशन एक्सपेंशन, हर खेत को पानी. Soil health card, soil testing for farmers, tells exact nutrients needed. PM Kisan, most important, 6,000 per year goes directly to farmers' bank account via DBT, no middleman. 11 crore farmers covered. 11 crore farmers. So that's around 1/10 or less of our population. Theme 2 is women and child schemes. मतलब ज़्यादा पैसे अगर हम दे सकते थे फार्मर्स को, अगर वहाँ पे पॉपुलेशन कम होती तो, मतलब कम लोग फार्मिंग कर रहे होते, सो इट वुड हैव हेल्प मोर. एनीवेज, थीम 2 इज़ वुमेन एंड चाइल्ड स्कीम्स. सो बेटी बचाओ बेटी पढ़ाओ, गर्ल्स एजुकेशन प्लस सर्वाइवल, लॉल, launched 2015, Haryana first. I am from Haryana and I've seen this. Like, I've seen the shit part of it. Sukanya Samriddhi. Savings scheme for girl child, 8% interest rate, tax free. I've heard it's like the most interest you can get from like saving accounts. Sukanya Samriddhi, but most people don't know about it. इसका भी कुछ करना चाहिए आई गेस. इन्हें ना ऐसे कुछ करना चाहिए, जैसे एक ऐप बना के उस पर आधार कार्ड लिंक एंड जो भी जिस भी स्कीम्स के लिए हम अवेलेबल है, जो हम पे अप्लाई हो रही है, ऑब्वियसली उधर हमारे सारे डॉक्यूमेंट्स होंगे, सो जो हम पे अप्लाई हो रही है वो हमारे सामने आ जाए खुद से, वरना तो कोई कैसे ही पता लगाएगा, स्पेशली दोज हु डोंट हैव एक्सेस टू अ लॉट ऑफ दीज टेक्नोलॉजीज. Poshan Abhiyan, nutrition for mothers plus children, reduces stunting and anemia. Poshan Abhiyan. Ujjwala Yojana, this was fire, right? LPG. Free LPG to poor women, 9 crore connections given. Maternity benefit, 5,000 rupees to pregnant women, first child only. What are you doing with this? Like, some people would use this to, you know, just get the money benefit, especially poor people. 5,000 is a lot for the very poor. I don't want them to use their children. Anyways, I'm saying कि मतलब कुछ लोग pregnant इसलिए होंगी women to get this money. Don't you think so? Ujjwala Yojana, Most exam important women scheme, free LPG cylinder to BPL women, replaced cooking on wood or dung, reduced indoor pollution, air pollution, women's health improved dramatically. 9 crore beneficiaries. Nice. Health schemes. Theme 3 is health schemes. Let's see. आयुष्मान भारत की दो ब्रांचेज है, PMJ and HWC. So PMJ is free hospitalization 5 lakh per family per year, and HWC is healthcare and wellness centers, 1.5 lakh centers in villages. NHM is National Health Mission, rural plus urban health infrastructure. Mission Indradhanush is vaccination drive, 90% plus immunization coverage target. PMJJBY is life insurance for poor, 2 lakh covered at 436 per year. 2 lakh when? मतलब अगर कोई क्राइसिस आती है तो उन्हें 2 लाख रुपए मिलेंगे if they keep on giving this much per year. Life insurance for poor. बट आयुष्मान भारत है तो 5 लाख पर फैमिली पर ईयर. PMSBY is accident insurance, 2 lakh cover at ₹20 per year. भाई ये तो ज़्यादा हो गया, मुझे लगता है ये तो सबको करा ही लेना चाहिए, स्पेशली द पुअर पीपल जिनके लिए ये है. लॉल. आयुष्मान भारत वर्ल्ड्स लार्जेस्ट गवर्नमेंट हेल्थ इंश्योरेंस स्कीम. वो तो बन ही जाएगा, इंडिया की पॉपुलेशन इतनी है. 50 crore Indians, bottom 40% population, covered cashless treatment at government and private hospitals. अब मुझे इतना बुरा लग रहा है, मतलब 50 crore Indians, bottom 40% can't afford by themselves good quality health care, कि उन्हें गवर्नमेंट इंसेंटिव्स और इन सब चीज़ों की हेल्प चाहिए, कैशलेस ट्रीटमेंट चाहिए. What does it say about us as a society? Direct face to essay example every time health is discussed. Okay. PMSBY at 20 rupees per year. Cheapest insurance in world. Almost. Almost? What do you mean almost? Less than cost of one samosa. By the way, samosa here is 10 rupees for me, like in my locality. So not less than one samosa, maybe premium samosa they're talking about. Accident insurance for 20 rupees, 2 lakh coverage. Classic exam trick question on insurance. Nobody would believe it अगर मैं किसी को बताऊंगी तो. Lord, this is hilarious. Theme for housing and infrastructure. Let's see. PM Awas Yojana, urban and Grameen. So houses for urban poor and rural poor. So urban poor, 1.12 crore houses sanctioned, 2.95 crore houses built. मतलब अभी अर्बन में बिल्ट नहीं हुआ है, रूरल में बिल्ट हुआ है. स्वच्छ भारत टॉयलेट्स प्लस क्लीनलीनेस, 11 करोड़ टॉयलेट्स बिल्ट. जल जीवन मिशन, टैप वाटर टू एवरी होम, हर घर जल बाय 2024. वैसे इन टॉयलेट्स बनाने का क्या फ़ायदा है? सीन लाइक द पब्लिक टॉयलेट्स कितने गंदे होते हैं, इतनी स्मेल होती है उसमें से. हु वुड यूज़ देम? मतलब ये बना तो देंगे. एनीवेज, जल जीवन मिशन टैप वाटर टू एवरी होम बाय 2024. तो अब तक हो गया क्या? उड़ान स्कीम, अफोर्डेबल रीजनल फ्लाइट्स, 2500 फेयर कैप ऑन रूट्स. व्हाट डू यू मीन? मतलब इससे ज़्यादा ऊपर प्राइस नहीं कर सकते? मोस्ट पुअर पीपल हैव नेवर हैड फ्लाइट्स like airplanes. They have never sat in airplanes. So would this even matter to them? I don't know. Swachh Bharat, most visible scheme. Open defecation free India declared 2019. 11 crore toilets built in 5 years. Women's safety, dignity plus health impact massive. Won India global recognition. लॉल. मतलब रिकॉग्निशन किस चीज़ में? ओपन डेफिकेशन बंद हो गया है इंडिया में 2019 में, वो भी लॉल. सॉरी, आई एम सॉरी. जल जीवन मिशन, only 17% homes had tap water in 2019. सही में. Target 100% by 2024. Massive infrastructure plus healthcare impact reduces waterborne disease, reduces child mortality. Honestly, मतलब गुड़गांव में रहते हुए मैं इमेजिन भी नहीं कर पा रही हूँ कि ओनली 17% होम्स है टैप वाटर. मतलब बाकी लोग कैसे जी रहे हैं यार. एंड 17% होम्स, मतलब सारी सिटीज़ मिला दे तो ज़्यादा ही होम्स होंगे ना. बस even cities doesn't have good tap water like all the cities like Surat and all that, who are like not top cities but they are cities. So how were they having water? Like were they using groundwater? Okay, so theme 5, employment and skills. Magnarega, 100 days rural employment. Key fact is 220 rupees per day wage. PM Mudra Yojana, loans to small businesses. PM Mudra Yojana, loans to small businesses up to 10 lakh, no collateral. अच्छा. पर 10 लाख में कोई बिजनेस खड़ा होता है क्या? I don't know actually. 10 lakh is not a big amount for. But if they can't repay, तब क्या होता है? Anyways, Skill India, vocational training, 40 crore trained by 2022 target. तो इससे क्या एम्प्लॉयमेंट बढ़ेगी? आई एम नॉट एक्सपेक्टिंग एनी बिग स्किल्स दे आर टीचिंग. आई थिंक वो ज़्यादा से ज़्यादा औरतों को सिलाई सिखा रहे होंगे. व्हाट द हेल. स्टार्टअप इंडिया, support for startups, tax exemption, easier compliance. Stand Up India, loans to SC/ST plus women, 10 lakh to 1 crore. For what? ये Stand Up India किस लिए है? ये loans किस चीज़ के लिए हैं? And if this is without collateral, then what is the guarantee they can repay it back? Especially SC/ST, poor people. Okay, so PM Mudra Yojana, most important employment scheme after Manrega. Okay, three. PM Mudra Yojana, most important employment scheme after Manrega. क्या था Mudra Yojana? Loans to small businesses. Okay. So these three categories: Shishu up to 50,000, micro businesses. Kishore is a teenager. So 50,000 to 5 lakh. And Tarun is a tree. Lol, what a naming system. Tarun is 5 lakh to 10 lakh loan, no collateral needed, 4 crore plus loans given annually. Nice. So 10 lakh tak ka loan. Okay. Theme 6, Digital India schemes. Digital India. Theme 6. पर मैं सोच रही हूँ इन स्कीम्स के बारे में ज़्यादातर लोगों को पता ही नहीं है जिनको इसकी ज़रूरत है. गवर्नमेंट शुड डू समथिंग अबाउट दिस, कि लोगों को पता हो कि वो कौन कौन सी स्कीम्स अभी यूज़ कर सकते हैं और वो नहीं कर रहे हैं. थीम 6, डिजिटल इंडिया schemes. Scheme, what it does and key facts. Let's see. Digital India builds digital infrastructure and services umbrella program, so it has a lot going on under it. UPI is instant digital payments, 10 billion plus transactions per month. I guess that's the biggest in world. No, biggest in world नहीं. मैंने पढ़ा तो था. Here it is. India's UPI, India's greatest digital achievement. India does more digital transaction than USA plus Europe combined. Built by NPCI, National Payment Corporation of India, now exporting to other countries. Singapore, UAE, France use UPI. RBI oversees payment system regulations. But UPI मतलब Indian rupees के लिए है या फिर it can like do dollars and stuff? I don't know. Anyways, तो इससे इंडिया का क्या फ़ायदा हो रहा है अगर UPI यूज़ किया जा रहा है? इज़ UPI like Indian system completely? Anyways, so Aadhaar is a unique biometric identity, 135 crore plus enrolled. I hope मतलब ये सारी स्कीम्स भी आधार के अंडर ही किसी ऐप पे हमें देखने को मिल जाए. डिजी लॉकर और आधार को मतलब जोड़ के करा जा सकता है. DigiLocker is digital document storage, stored certificates, licenses digitally. BharatNet is India Internet to villages. 2.5 lakh gram panchayat connected. 2.5 lakh gram panchayats connected. Okay. Um, BharatNet. Interesting. CoWIN, COVID vaccine platform, 2 billion plus vaccine tracked. तो अभी ये तो यूज़ में नहीं होगा ना कोविन. Let's see. Jam Trinity connects Jandhan bank account, Aadhaar and mobile connectivity. DVD possible. 2.73 lakh crore leakage saved. This is India's biggest governance reform story. Nice. But I don't think corruption has stopped anyways. Theme 7 education schemes. Let's see. So first is PM Poshan. This is nutrition scheme, isn't it? Midday meals in schools. 12 crore children fed daily. समग्र शिक्षा, बट आई डोंट थिंक वो फूड का क्वालिटी कुछ अच्छा होगा या टेस्ट. समग्र शिक्षा, स्कूल एजुकेशन अम्ब्रेला. प्री स्कूल टू क्लास 12 समग्र शिक्षा. ये देखना पड़ेगा मुझे, बिकॉज आई हैव समबडी हु नीड्स इट. अगर मतलब एजुकेशन में हेल्प हो रही है तो. NEP 2020 न्यू एजुकेशन पॉलिसी. मदर टंग टीचिंग कोडिंग फ्रॉम क्लास 6. PME विद्या डिजिटल एजुकेशन 1 क्लास 1 चैनल TV. ये NEP 2020 अगर आ गया है so why isn't it like my brother learning his subjects in his mother tongue yet? It's not happening, or it implementation अभी शुरू नहीं हुआ है या फिर क्या चल रहा है. ये गवर्नमेंट स्कूल्स में इम्प्लीमेंट हुआ है अभी. नो स्ट्रिक्ट पॉलिसी. PME विद्या इज डिजिटल एजुकेशन 1 क्लास 1 चैनल TV. मैंने ये देखा है, बहुत बकवास पढ़ाते हैं, बहुत बकवास, बहुत बोरिंग एक्चुअली. एकलव्य स्कूल्स, ट्राइबल रेजिडेंशियल स्कूल्स, क्वालिटी एजुकेशन फॉर ट्राइबल्स. पर रेजिडेंशियल स्कूल्स मतलब वो वहाँ पे रहते भी हैं क्या? एकलव्य वॉज अ ट्राइबल. वाओ, मैं तो भूल ही गई थी. एकलव्य वॉज अ ट्राइबल. ST. हाँ. PM पोषण मिड डे मील. I like Eklavya, by the way. PM Poshan midday meal, quietly one of India's most impactful schemes. 12 crore children get free nutritious meal daily. Do I want to trust the government? I don't yet trust the government, I'm sorry. Increases school attendance, especially girls. Okay. Reduces malnutrition, employs women as cooks in villages. 3 benefits from one scheme. Nice. NEP 2020, biggest education reform since 1986. 5 plus 3 plus 3 plus 4 structures replaces 10 plus 2. Mother tongue as medium till class 5. Coding from class 6. बोर्ड एग्ज़ाम्स ट्वाइस अ ईयर. अच्छा, ट्वाइस अ ईयर होने लग रहा है, मुझे तो पता ही नहीं था. होलिस्टिक असेसमेंट, नॉट जस्ट मार्क्स. व्हाट इज़ दिस 5 plus 3 plus 3 plus 4? 6, 10, 15. What do you mean? Anyways, theme 8, environmental scheme. Finally, National Solar Mission, 100 gigawatt solar target. उजाला LED बल्ब डिस्ट्रीब्यूशन, 37 करोड़ बल्ब्स डिस्ट्रीब्यूट करेंगे, वो ख़राब हो जाएंगी. व्हाट डू यू मीन? हाँ. फेम इंडिया, इलेक्ट्रिक व्हीकल प्रमोशन. इससे एक्चुअली इंडिया को फेम भी मिल सकता है. व्हाट अ नेम. पीएम कुसुम, सोलर पंप्स फॉर फार्मर्स. बट इसका नाम कुसुम क्यों है? Anyways, green hydrogen mission, clean fuel for future, but hydrogen is harder to handle. मतलब उसके लिए technology is built हो रही है. What do you mean? What is this scheme about exactly? Ujala scheme, most underrated scheme, replaced incandescent bulbs with LED at subsidized rates, saved 47 billion units of electricity annually. Wow. Reduces 19,000 crore electricity bills for consumers. Wow, 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 wow. And reduces carbon emissions. Simple scheme, massive impact. I didn't knew, but LED मतलब बल्ब उनने बांट भी दिए हैं तो वो तो खराब होते जाएंगे तो कितने मतलब बांटते ही रहेंगे. Anyways, the smart way to remember schemes. Don't memorize, connect to problems. Problem: farmer price cash, MSP plus ENAM, no insurance, PMFBY and PMJJBY, no toilet, Swachh Bharat, no water, Jal Jeevan Mission, house, PM Awas Yojana, job, Magnarega and Mudra. मुद्रा क्या था मैं भूल गई. अच्छा वो लोन्स 10 लाख तक के बिना कोलेट्रल के. बैंक अकाउंट्स, जनधन, हेल्थ कवर, आयुष्मान भारत, गर्ल्स नॉट स्टडिंग, बेटी बचाओ बेटी पढ़ाओ. उसमें ये कर क्या रहे हैं बेटी बचाओ बेटी पढ़ाओ के अंदर? No cooking gas, Ujjwala. Exam strategy: when asked about any social problem, immediately connect to 2 to 3 schemes plus their key numbers plus their limitations. Schemes, number, limitations, complete answer. Okay, let's see questions. A poor tribal woman in Jharkhand, no bank account, no toilet, no cooking gas, no health insurance, no house. List all the government schemes she is now entitled to and what each gives her. How has Jam Trinity made delivery of these schemes more effective? I don't know how Jam Trinity had made delivery better. Anyways, no bank account, then the Jandhan Yojana can help. No toilet, Swachh Bharat, no cooking gas, Ujjwala, no health insurance, Ayushman Bharat, no house, Awas Yojana, Pradhan Mantri Awas Yojana. These schemes are now hers. She is entitled to getting it, but how would she know? I hope Jam Trinity helps like make her informed that she is available for these schemes. How has Jam Trinity made delivery of these schemes more effective? First, she can get the money from government directly to her, no middleman, so that is great. And Aadhaar card and mobile number can maybe used. Aadhaar card can be used to like stop black money and fake accounts from getting the benefits from actual people, and mobile numbers can be used to inform her that she is available for these schemes, but I don't think that is happening, or something like that can happen. Anyways, so a second question is: Magnarega is criticized for creating unproductive work. PM Mudra gives loans for self-employment. Skill India gives vocational training. If you had to design one comprehensive employment scheme combining best of all three, what would it look like? I have actually never thought about employment because I think that's a very complicated and complex problem to solve. I have to see like I need to read more on that actually. But from these three, I think yes, Magnarega is definitely creating unproductive work. I would use Magnarega and I would like join it with vocational training, skill training basically. So I think poor people should be paid for learning, paid to attend classes, paid to interact, and all that. They can be given scores and money as per the learning they do. And maybe based on the learning and skill level, they can be granted those loans, those mudra schemes. Because now, even if they don't have collateral, we can rely on their skill level. This is how I would like to combine these three if I had to like do it. Question number 3 is India spends only 2.1% of GDP on healthcare and 2.9% on education, amongst the lowest in the world. Yet Ayushman Bharat and PM Poshan are celebrated as revolutionary. How can schemes be revolutionary while overall spending remains low? What's missing? Obviously, these are celebrated as revolutionary because politicians want to show people that they are doing work when they are actually not, and this is really embarrassing to and humiliating also to see these numbers, like literally 2.1% for healthcare and 2.9% on education. What the hell is going on? Okay, so Ayushman Bharat is only 5 lakh per family per year. I don't think that's enough, and I know people who are entitled to this scheme but they are not able to get it. I don't know what was the problem, I don't remember, but they didn't get the benefit. And PM Portion, I actually tasted one of the protein bars from what is that called Anganwadi. So I got a chance to taste one protein bar from Anganwadi, and that was disgusting. That was absolutely disgusting. How would anybody eat that? That's that's complete nonsense thing. And I actually once in the same Anganwadi I saw sanitary pads, and that looked like complete plastic, and those were so rough and harsh. I don't think any girl would want to put them on under um, I don't think that would be a great idea to use those government sanitary pads that they got from government. Those were horrible, absolutely horrible. But these are being celebrated because those who are not poor, right, they only get to see the numbers, they don't know the ground reality. And overall spending remains low. I don't know what exactly is missing, but this is the perspective that I have right now. I think I need more knowledge in question 3. The question 3 is most powerful thing you have written in 14 days. Really? But I have not written anything. The protein bar, the sanitary pads, the person who couldn't access Ayushman Bharat, that's not just opinions, that's ground truth that economists and policymakers never see. Let me grade everything first. Tribal women's entitlement. Correct plus smart observation. You listed schemes correctly. Full picture. No bank account, Jan Dhan Yojana. No toilet Swachh Bharat, cooking gas Ujjwala, no health insurance Ayushman, no house PM Awas Yojana, Grameen. Bonus she also gets. अच्छा ये भी कर सकते थे. मनरेगा for like 100 days guaranteed work, PDS 5 kg free food grain monthly, PMJJBY 2 lakh life insurance, and PMSBY like 2 lakh accident covers. I was thinking this is about like car accident and bikes accident. Nah, it is about overall accident, isn't it? मतलब एक इंसान का चलते चलते भी कहीं एक्सीडेंट हो जाता है, सो डज डेट कवर इट. ऑल्सो इसे उस लेडी को ये सब बताएगा कौन, ये सारी इन्फॉर्मेशन उस तक पहुंचाएगा कौन? बिकॉज आई डोंट थिंक शी इज़ इन अ लाइक हेल्दी माइंड सेट और लाइक स्टेट ऑफ माइंड, गुड स्टेट ऑफ माइंड कि वो खुद से ये सब जान पाए. क्योंकि those people who are struggling are also struggling with their mental health, and there is so much stress around them. I don't think they would research this much. Jam Trinity made delivery better. Your answer was correct. Before Jam, 100 rupees sent by government, 15 reached beneficiary. Oh, 85 stolen by middlemen. Chi yaar, matlab literally fake accounts, corrupt officials, चोर 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 भरे हुए हैं हमारे देश में. लॉल. After Jam, Jandhan account, real account linked to real Aadhaar. Money gets directly, no middleman possible. 2.573 lakh crore leaked plug since 2014. Your point about mobile informing her actually happening? SMS alert sent when DBT credited to account. What DBT credited? DBT क्या था, मैं भूल गई, प्लीज़ दोबारा से. Question number 2, your combined employment scheme outstanding. This is the original position. Your idea, pay people for learning. 1 minute. Okay, so your idea, pay people for learning, score them on skill acquisition, use skill score as collateral for Mudra loans. You just independently invented human capital as collateral, an actual concept in development economics. Traditional collaterals are land, gold, property. Your idea is skill certification collateral. This is being piloted in some microfinance programs right now. Wow, great, nice. Official exam answer. Your scheme named properly. A comprehensive scheme combining Magnarega's income guarantee, skills India's training, and Mudra's credit access could work as follows. Beneficiary receives stipend like Magnarega wages for attending certified skill trainings. Upon completion, skill certificate act as collateral for Mudra loans. This creates a pipeline from poverty to skill to entrepreneurship. Poverty to skill to entrepreneurship to income independence. This addresses root cause rather than perpetuating dependency. But I also think कि मतलब अगर जैसे फॉर एग्जांपल किसी को ऑलरेडी सिलाई आती है या फिर उसे मतलब जैसे क्लासेस में बैठ के सीखना नहीं पसंद, उसने यूट्यूब वगैरह से सीखा है. सो आई वांट कि उसके लिए मतलब एक अलग से एग्ज़ाम्स वगैरह कुछ कंडक्ट कराए जा सकें जिससे उसे सेम वो सर्टिफिकेट मिल सके जिसके साथ वो फिर मुद्रा क्रेडिट लोन मतलब एक्सेस कर सके मुद्रा लोन्स एंड ऑल डैट. So yeah, this is great. This addresses root cause rather than perpetuating dependency. And I really hope कि ये जो ये skills सिखाएंगे ना, इसमें बस लड़कियों को सिलाई ना सिखा रहे हो. Yep, whatever. Question number 3, revolutionary schemes, low spending. What revolutionary schemes, low spending? Your best answer yet. The protein bar, the plastic sanitary pads, the person who couldn't access Ayushman Bharat despite being entitled. This is the answer to question 3. Let me frame it properly. Your answer exam version. India's paradox of celebrated schemes amid abysmally low public spending reveals a fundamental gap between policy design and ground reality. Ayushman Bharat covers 5 lakh per family, revolutionary on paper, but awareness gaps, hospitals empanelment failures, the bureaucratic barrier prevent actual access. Beneficiaries entitled to coverage cannot navigate the system. Exactly, they are not able to navigate through the system. PM Poshan feeds 12 crore children daily, but quality of nutrition provided as ground reports suggest often fails to meet actual nutritional standards. Quantity without quality is not nutrition security. Yes, at 2.1% GDP on healthcare and 2.9% on education, India ranks below sub-Saharan African average. What a shame. Well-designed schemes cannot compensate for structural designed schemes cannot compensate for structural underfunding. What's missing? Last mile delivery infrastructure, quality monitoring at ground level, adequate per beneficiary spending, adequate enough per beneficiary spending, genuine accountability beyond optics. आई थिंक दीज पीपल शुड पोस्ट इट. मतलब मुझे पोस्ट कर देना चाहिए था वो सैनिटरी पैड्स का रिव्यू ऑनलाइन. एंड आई होप मतलब वो वायरल वगैरह हो या उसके लिए एक अलग प्लेटफॉर्म भी हो सकता है. Anyways, true social sector revolution requires not just scheme design but sustained, adequate, monitored public expenditure, something India has consistently deferred in favor of visible announcement and over invisible outcomes. Visible announcement over invisible outcomes. Remember this phrase for I say exactly. ये सब ट्रैक नहीं करना चाहिए कि कितने लोगों को खाना खिलाया या फिर ऑल दैट थिंग. हमें ये ट्रैक करना चाहिए आई गेस कि अभी न्यूट्रिशनल मतलब क्या स्टेटस है यहाँ पे बच्चों का, पुअर पीपल का, उनके न्यूट्रिशन लेवल क्या है. आई थिंक दैट शुड बी ट्रैक्ड एंड सेलिब्रेटेड, एक्चुअल हेल्थ ऑफ पीपल. Okay, so day 14 done. One thing before we continue, you said those who are not poor only see numbers, not ground reality. That observation that's worth more than any textbook. The protein bar story, the sanitary pad story, right exactly like that in phase 2 essay, not formal language pretending to know. Real observation plus economic framings. The examiners reads hundreds of identical essays, yours will be different. Okay, key schemes, cheat sheet, problems, no bank account, Jandhan, की नंबर 50 करोड़ अकाउंट, ये अभी याद करने की चीज़ नहीं है बट लेट्स रीड इट एनीवेज. सो नो बैंक अकाउंट जनधन 50 करोड़ अकाउंट्स ओपन हुए हैं या फिर हेल्प इसकी इसके एंड आई गेस. नो टॉयलेट स्वच्छ भारत 11 करोड़ टॉयलेट्स बिल्ड हुए हैं. नो गैस उज्ज्वला 9 करोड़ कनेक्शंस आर गिवन. नो हेल्थ केयर आयुष्मान भारत 5 लाख पर फैमिली. आई गेस 10 करोड़ फैमिलीज are under come under it. No house PM Awas 4 crore houses built or sanctioned. No farm income PM Kisan 6,000 per year. No job Manrega 100 days works. No small business Mudra 10 lakh. No collateral. No digital identity Aadhaar 135 crore enrolled. No food PDS and FSA 5 kg free grain per month. For day 14 done. Tomorrow day 15 sustainable development and environment, climate change, Paris Agreement, India's commitments, green economy, increasingly important for RBI's grade B as climate risk becomes financial risk. Okay, so see you tomorrow.